Welcome to episode 44 of Pulse of Physiology. I'm your host, Dr. Jim Davis, and today we're discussing blood pressure, the driving force that moves blood through the cardiovascular system. Blood pressure plays a fundamental role in ensuring adequate oxygen and nutrient delivery to tissues while also removing metabolic waste. By the end of this episode, you should understand the relationships between blood flow, pressure, and resistance, as well as how factors like vessel diameter, cross-sectional area, and blood velocity affect blood pressure. So let's get started. To understand blood pressure regulation, we must first define three key terms. Blood flow, often abbreviated as Q, is the volume of blood leaving the heart per minute, also known as cardiac output, which is often abbreviated as QC, as we've discussed earlier. Blood pressure, or delta P, is the force exerted by blood against vessel walls, and it's usually measured in millimeters of mercury. And then finally, we have resistance, also abbreviated as R, which is a measure of how difficult it is for blood to flow through a vessel, and this is largely influenced by vessel diameter. These variables are related by the equation, which can also be written as this. Flow equals the change in pressure divided by resistance. This equation shows that blood pressure increases when either cardiac output or resistance increases. Arterioles, also known as resistance vessels, have the most significant effect on mean arterial pressure because they can change diameter in response to physiological demands. Vasoconstriction, which is the narrowing of arterioles, increases total peripheral resistance, TPR, which raises mean arterial pressure. Vasodilation, which is widening of arterioles, decreases TPR, which lowers mean arterial pressure. Now, arterioles adjust their diameter based on three different types of factors. First, there are local factors. So these include oxygen and carbon dioxide levels, as well as temperature and blood flow demands. Then there are hormonal control, and this is when things such as the renin-angiotensin system, vasopressin, and atrial natriuretic peptide act upon the arterioles. And finally, there's neural control, and so this occurs when the sympathetic nervous system sends signals to the arterioles. Now, mean arterial pressure, or MAP, M-A-P, is the average pressure driving blood through the systemic circulation. It's calculated using the equation where cardiac output equals heart rate times stroke volume, and total peripheral resistance is determined by arterial tone. Since MAP is directly influenced by cardiac output and resistance, any changes in heart rate, stroke volume, or total peripheral resistance will alter blood pressure. You can calculate mean arterial pressure by multiplying heart rate, stroke volume, and total peripheral resistance together. Now, as blood moves through the systemic circulation, vessel characteristics change. Vessel diameter decreases going from arteries to capillaries, which increases resistance. Cross-sectional area increases in the capillaries, which decreases resistance and blood velocity, which facilitates nutrient exchange. Blood velocity also decreases going from arteries to capillaries, but then it again increases as we go back into the veins. Now, blood pressure follows a pressure gradient, decreasing as blood moves from the left ventricle to the veins. The arteries have high pressure due to strong ventricular contraction and arterial elasticity. Capillaries experience a moderate pressure, which allows them to have efficient exchange. Finally, there are veins. They have low pressure due to their high compliance, or their ability to stretch out, and reliance on valves and muscle pumps to assist blood return to the heart. Now, pulse pressure represents the strength of the pulse wave and is calculated as systolic blood pressure minus diastolic blood pressure. If you recall, systolic blood pressure is the highest arterial pressure during contraction, whereas diastolic pressure is the lowest arterial pressure during relaxation. A high pulse pressure can indicate stiff arteries or aortic regurgitation, while a low pulse pressure suggests heart failure or reduced stroke volume. So let's wrap up with our four key takeaways. To summarize, blood pressure is determined by cardiac output and resistance. So mean arterial pressure equals cardiac output times resistance. Arterioles regulate resistance through vasodilation and vasoconstriction. Vessel diameter, cross-sectional area, and blood velocity change throughout circulation to optimize flow and exchange. Pulse pressure reflects stroke volume and arterial elasticity. And so with that, we're done for episode 44 of the Pulse of Physiology. I hope this episode has helped you understand the determinants of blood pressure and its regulation and circulation. Come back for episode 45, where I'll discuss the Braille reflex and how the body maintains stable blood pressure. Until then, keep questioning, keep exploring, and stay curious.